Thanks, Dustin. Tomorrow, November 21st, is the Great Smokeout, which is a day where everyone is encouraged to not smoke for an entire day as part of Lung Cancer Awareness Month. Our guest here to talk about all of that this morning is Jennifer Lewis, who is ECU Health Cancer Center Outreach Coordinator. So let's get things started. What in general is the Great Smokeout?
So the Great Smokeout is an American Cancer Society initiative that started about 50 years ago.
Yeah.
And we recognize the Great Smokeout on the third Thursday of every November each year. And that's tomorrow. And it's a day set aside that smokers, they can stop for 24 hours. And if they can do it for 24 hours, hopefully they can do it for even longer, right? And if you don't have a plan to stop tomorrow, make a plan.
Yeah.
That's the important thing, is just making that plan. And there's lots of resources that can help you do that.
And we talked about how lung cancer does affect more people than most realize. Can you talk about some of the resources that are here in the East for those that are facing it?
So lung cancer, you know, it is the #1 cause of cancer-related death in North Carolina, in the United States, and in the world. So smoking is the #1 cause of lung cancer.
Yeah.
So 80% of all lung cancers are caused by smoking. Not to mention that smoking causes a lot of other chronic diseases, and really just poorly affects one's quality of life. So there are many resources. Every state in the United States has a quit line, 1-800-QUIT-NOW. And that seems like a nice little band-aid. Oh, just call that number. But it is an excellent resource to help someone get started on that very difficult journey to stop smoking, but it can be done.
And let's talk about some resources if you want to start that journey of stopping smoking, and also what to look for. So if you need to be screened for lung cancer, you can make that appointment.
Right. So definitely speak to your primary care provider. Get some good friends, a good support group. You know, the American Cancer Society has a wonderful site about the Great American Smokeout. They list their resources. They have an email-based program that can help individuals stop smoking. Of course, they are supporters of the Quit Line. And there are a lot of smoking cessation programs available in our area. So, but I would like to just share, you know, if you do have a significant history of smoking, there are lung cancer screenings now. Many people don't realize that you can be screened for lung cancer. So if you have a significant smoking history, you're over the age of 50, you most likely meet the criteria, and insurance should pay. And if you don't have insurance, there's a program at ECU Health that will pay for a screening, low-dose CT, which is an excellent scan of a person's chest. Really shows any abnormalities, because we don't want to find lung cancer, but if we find it, we want to find it in its earliest state, when it's most treatable and the outcomes are better.
All right, and we'll be sure to get all that information on where you can go to schedule that screening on our website right after the show today. So thank you so much, Jennifer, for being here.
Thank you for having me.